we saw. Well, approximately 300,000 Americans are affected with Lyme disease each year, but only about 30,000 of those are reported. That leaves a staggering number of people suffering in silence because they are often misdiagnosed. We recently interviewed Darcy Karn, whose life was changed by a single unnoticed tick bite.
Leg pain, insomnia, migraines, radiating pain. I'd have pain in one part of my body. It would shut off. It would duplicate itself on the other side of my body. Toes turned purple. They thought I had MS. They thought I had lupus. I have white matter on brain MRIs, the gamut. Floaters, tinnitus in the ears, you name it. Never saw a tick, never had a bullseye. I've had rashes all my life, so they don't know how long I've had it. Bizarre things that would come up. They thought I had meningitis at one point in my life, but I was told I was crazy.
We're joined now by author of Why Can't I Get Better, Dr. Robert Horowitz. Doctor, thank you for being with us. We saw Darcy, and we saw her daughter Peyton with her, also a victim of Lyme disease. And Darcy's been undiagnosed for a long time. The CDC, this is so shocking. The numbers of those diagnosed with Lyme are 30,000, but the number of those that they say actually have it are 300,000 a year. Why is that? Why don't people know that they have Lyme disease?
Well, first of all, Lyme is the great imitator, so the blood tests are not reliable. So when people are diagnosed with chronic fatigue syndrome or fibromyalgia or MS, they think that's the disease that they have, and the doctors don't always think about Lyme. These ticks are very small, so you don't always see a tick bite, and many people think that they have to get a bullseye rash, but it's not true.
Right, so the bullseye rash, I mean, that's something that was flagged for years. If you didn't have that, it couldn't be Lyme. But you say, I mean, half of the people don't have that bullseye rash, but do have Lyme.
That's correct. In fact, half of those people, it doesn't even look like a bullseye. They think they get a spider bite or a red rash that looks like an infection in the skin. So many people are misdiagnosed.
So and Lyme is actually, you call it the great imitator. It's commonly mistaken for things like multiple sclerosis. We actually heard her say that someone diagnosed her with that, chronic fatigue, fibromyalgia, rheumatoid arthritis, lupus, meningitis. So if you're getting one of those diagnoses and not Lyme, are you ever going to get better if you don't get the Lyme diagnosis?
Well, you can get better, but the problem is it can be cured early on in the first 30 days. But the people who see me, I've seen over 12,000 chronically ill people. They go to 20 doctors, they can't get a diagnosis, and they come to see me, and what I find is it's like them having 16 nails in their foot. They don't just have Lyme. They have many other bacteria, parasites, viruses, food allergies. They may have toxins in their body. So many different reasons why they stay sick.
So if the first 30 days are so critical, why isn't the testing accurate? You go to your doctor, you're not feeling well, you may not have a bullseye rash. What's wrong with the testing that in those 30 days, when the most can be done to help Lyme disease, you're not getting the answer?
That's right. It takes a while for these antibodies to be formed, the blood tests that the doctors are relying on. So they're looking at new testing now to figure out whether we can find the organism early on, because it's crucial, because we're talking about the #1 spreading epidemic worldwide as far as a bacterial infection.
So if someone's, I mean, summertime, we obviously know the rate of tick bites is high. If you're in an area that's known to have prevalence of Lyme disease there, you're not feeling well, no one's giving you answers, what's your advice to patients out there today? What do they say to their doctor? What test should they get?
Well, they need to know that it's a clinical diagnosis. If you have good and bad days, and the symptoms are coming and going, and the joint pain, muscle pain, and nerve pain, tingling, numbness, burning, it's moving around your body, and you have headaches, stiff neck, light sensitivity, sound sensitivity, memory problems, depression, anxiety, you can't sleep. If you have a multi-systemic disorder, many symptoms, and it's coming and going, you're better with antibiotics, or you're worse, or women are worse around the menstrual cycle, that's the clinical diagnosis of Lyme, which is ruled out under diseases. So the doctors shouldn't just do an ELISA test, the first test, but a Western blot, because there's 100 different types of Lyme in the United States, and 300 types worldwide, and that's why this one test doesn't pick it up.
If you go into your doctor's office and you ask for the Western blot test for Lyme because you suspect that you could be one of these cases, 270,000 people are walking around every year with Lyme disease and don't know it. Will they give you the Western blot test?
Well, the problem is right now is that the insurance companies sometimes only want you to do the ELISA, and they don't want you to do the Western blot, and even the Western blot only picks up one of these types of strains of Lyme, not the other 99. So you're really dealing with a difficult problem with a spreading epidemic without reliable